Well, thanks for tuning in and joining us for part two of Lockdown Nutrition, um, where I'm going to review a few concepts from our first session and also give you quite an important update about the nitric oxide hypothesis. Uh, and most importantly, though, I just want to make sure that people realize that they can be empowered by information to uh, take charge and improve their health optimally in the face of unprecedented pandemic, unprecedented in modern times, that's for sure. So stay with me because we're going to have a wonderful recipe to share with you at the very end. One of my friends from Sri Lanka and told me about her childhood and uh, kind of food and cooking that they did when she was young, and I developed a very tasty, easy to make recipe that I know you'll love. So stay tuned for that. Okay, let's take a look at nutrition in the time of COVID. What we'll look at in today's session is to review and update the nitric oxide hypothesis. Quite a few people gave me feedback and suggested that the first one was a little technical, excuse me, from my professorial days. I get a little overexcited about technical aspects of nutrition and health and biochemistry. Today I'll take you through some of the key practical aspects of that hypothesis. Um, we'll talk about how to reverse risk factors for COVID, for key anti-COVID foods, for key lifestyle factors, and we talked last time about different challenges to making these kind of big changes, the big positive changes to really make a difference in your health. There are many challenges, otherwise a lot more people would be doing it. So I'll take you through the low carb death curve. So stay tuned for that. And as I mentioned, I'll save the absolute best for last. Stay with us until the end of the presentation for a wonderful recipe, which I'll also send out to everyone by email. And if you're not already on the email list, please contact me, let me know, and I'll put you on the list. Thanks so much for tuning in today. So, quick review again. The nitric oxide hypothesis arose from trying to understand why this virus disproportionately affects older people, and in particular, as we'll see, people with very specific so-called comorbidities, a certain set of health issues that predominates amongst those who seem to have a very difficult time in if they do get the virus. Normally, what happens is children are disproportionately affected because their immune systems are not fully developed. And as people get older as well, their immune systems decline, and that makes them more susceptible to infections, viruses, bacterial infections, etc. So what is really striking, if you look at the data from different countries, different studies, is a very clear pattern that it isn't just older people who have a really tough time with this virus, but it's a pattern of people with cardiovascular disease, hypertension, obesity, diabetes, as well as respiratory diseases like chronic obstructive pulmonary disease, which makes a lot of sense as this is a respiratory virus. But on the other hand, there's this clear pattern of diseases which are actually happen to be the same diseases that are the major causes of mortality in our society. And the really good news is that these same diseases can be prevented and even reversed with really close attention to nutrition. So what is the key thing about the nitric oxide hypothesis? Key to the hypothesis, and I'll speak briefly about support for my hypothesis that was just published in the Journal of the American Medical Association. The endothelium, so that's a big word, endothelium. What is it actually? It's the cells that line the interior surface of our blood vessels and our lymphatic system. So you can imagine there's this huge surface area of our blood vessels where called the endothelium. And this area is so large that it takes up the size of a football field, which is remarkable. And the common feature of these endothelium is that we develop endothelial dysfunction. In other words, there's damage to the endothelial layer the size of a football field that gradually accrues over time. Most people think of hypertension, cardiovascular diseases as things that occur as we get older, but in fact it's a disease process that acts over our whole lifespan. So even as children, by the time children get to be 10 or 12 years old, we can start to see the beginnings of the fatty streaks that are characteristic of atherosclerosis and ultimately give rise to hypertension, to cardiovascular disease, which is also connected to diabetes, which is the major cause of death of people with diabetes, in fact. So it isn't a disease of aging. In fact, it's a disease throughout our whole lifetime. Even, as I say, children by the time they're 8 or 10 years old, and it's a consequence of what we eat as a culture. That's the important thing. And the other critical fact is that it's a reversible process. It actually, even after 40, 50, 60, 70 years, in fact, we can reverse this process. So very quickly, I'll won't spend too much time on the nitric oxide theory, but I went through it last time. You can check out part 1 of this series. But basically, the endothelium, all of the cells that line our blood vessels, produce nitric oxide. And as they become damaged over time, they produce less nitric oxide. And nitric oxide is, in fact, what keeps our arteries healthy, but it's also part of our immune system, known to help us kill off bacteria and viruses. It actually kills off the first SARS virus. Presumably, it will kill off this one. And it's also even being used as an inhaled gas in a clinical trial to treat COVID-19. So check out the first presentation. I go into that in more detail if you're interested. But what are the key points? Okay, stay with me for this. Is that to heal the endothelium, to reverse the dysfunction, and also to increase the production of nitric oxide to improve the immune system's capacity to fight off this virus, we really need green leafy vegetables. It's one of the most central parts of nutritional treatment or optimization of our immune system, which is very interesting. Okay, and there's two distinct pathways whereby green leafy vegetables can increase nitric oxide. The first is this cycle. Basically, green leafy vegetables and other vegetables like beets, for example, have nitrates. These compounds called nitrates are changed by most bacteria into nitrite, and the stomach acid can further change the nitrite into nitric oxide. So it's a very direct pathway, but here's the key thing. It requires saliva and bacteria in our, actually they live in our tongues, and they get into our saliva, so we really need to chew the vegetables thoroughly, mixing them with our saliva and allowing those tongue bacteria to act and begin a chemical process that ultimately produces nitric oxide. Very important, do not use mouthwash. I'll say that again. Do not use mouthwashes that kill bacteria, because they will kill the beneficial bacteria in your tongue. And in fact, if you eat a lot of green leafy vegetables, it will dramatically improve your breath, just through a lot of chlorophyll, a lot of other positive things. So second pathway, rather technical looking diagram, but essentially the green leafy vegetables can also help to restore the endothelial layer so that the endothelial cells themselves produce nitric oxide in the quantities that they did in your younger days. So as we get to be in our 50s or 60s, typically we produce half as much nitric oxide. But if we really enhance our consumption of green leafy vegetables, we can improve the ability to restore the endothelial cells so that they have the capacity to produce nitric oxide more efficiently. And I presented this theory in more detail in the first part of this series, but I was very heartened to see a paper April 22nd in the Journal of the American Medical Association. It talked about 5,700 patients hospitalized in the New York City area with COVID-19. And of course, the usual pattern of comorbidities came up. Not over 90% of people had these very distinct pattern. Once again, we had hypertension, we had obesity, we had cardiovascular disease, diabetes, the same pattern. And accompanying that article was a article by a professor and a medical doctor who essentially talked exactly about my theory. The key feature of these comorbidities is endothelial dysfunction. The cells lining our arteries are not working efficiently. And as a result, what this professor and medical doctor is suggesting is that we should look to drugs that can ameliorate, that can improve the endothelial function. What I'm suggesting, a little bit differently but complementary to that, is that nutrition can ameliorate the endothelial dysfunction. And if you're very sick in the hospital, it'd be wonderful to think about drugs that could help improve the endothelial function. But you can do that yourself at home in your kitchen very effectively. In fact, so effectively that I'll have a little caveat later on, which is if you decide to adopt a very powerful healing diet, you have to work closely with your medical doctor, because your health can improve so quickly, just in a matter of weeks, that you might need medications adjusted. So the main difference between my approach and this approach is nutrition. And in fact, there's no reason that with hospitalized patients they couldn't simultaneously use nutrition and medications together. Um, and if you're using nutrition at home this powerfully, as I say, you might not need any medications. That you, even if you've been taking them for years, often people can improve their health so much they no longer require medication. So the key point is that endothelial dysfunction, nitric oxide, seems to be a very important way of understanding and empowering ourselves to make the kind of changes that are necessary to optimize our immune system and our health, so that if we do get this virus, and hopefully we won't, but if we do, our ability to get a very mild case, or perhaps not even have any symptoms at all, is greatly enhanced by essentially reversing these comorbidities. It's only going to help optimizing our ability to have a positive outcome. And I should also really highlight the fact that these are the very same health problems that ultimately kill most of us in the long term. So after this virus is over and it's behind us, the major cause of death in our society is what we eat and these same diseases. So perhaps it's time to think about that. For example, we have a 50% chance in our lifetime of dying of cardiovascular diseases. Isn't it time to be concerned about that and to take steps to change that picture? Once again, make sure you can work with your medical doctor if you decide to make such powerful changes. I copied this from a lecture I saw recently by another medical doctor talking about this very same thing, that we have control over type 2 diabetes, blood pressure, cardiovascular health, our weight. We can improve our lung health by quitting smoking, making sure we control our asthma. In fact, diet has a very powerful beneficial effect on reducing problems with asthma as well. The only thing we can't control is age, according to this medical doctor, but actually I would disagree with that. There's two things. There's biological age and chronological age. In fact, we might be 50 or 60 or 70 or 20, but two people can be the same age, and yet their biological age, through measurements of all sorts of parameters, for example, the telomere is, we can look at, give us a sense of what is our biological age. Somebody could be 70 chronologically, but they could in fact be as healthy as average, average 50-year-old perhaps. So, and at the same time, we all know people who are 50 or 60 who obviously appear to be much older, in fact. So something else to keep in mind, as far as aging, there's a concept, for example, of inflammaging. We have this chronic inflammation, and as we get older and older, it accumulates, and it's very much connected. Inflammation is very much connected to the diseases of aging. But nutrition and other lifestyle factors can dramatically change this picture of inflammation. A lot of the inflammation stems from the kinds of food choices that we make every day. So what are the key nutritional strategies for improving the endothelium, producing more nitric oxide? The key thing, if you recall from our first session, was green leafy vegetables. 6 times per day is what is recommended by Dr. Esselstyn at the Cleveland Clinic, who has worked with patients for almost 40 years now, showing conclusively that even severe cardiovascular diseases can be reversed and people can go on to live very healthy lives after this reversal. And don't eat foods that damage the blood vessel lining. Stay tuned for part 3. I'm going to talk more about what people really eat and why they have so much damage from a young age. And we also talked about legumes, beans, pulses, peas, chickpeas, all that sort of stuff. Eat as many of those as possible. If you're not convinced that they're healthy for you, let me know. I can send you some research articles. Look it up for yourself. The most important dietary predictor of survival in older people of different ethnicities. What more can you say? So the key of nutrition is don't eat things that damage the endothelium. Eat lots of beans and greens, greens and beans, beans and greens. Eat every day. Ask yourself, what bean am I going to have today? Which greens am I going to eat today? And how many times am I going to eat them? Don't forget about exercise, sleep, manage your stress, particularly important in this time. Take up some meditation, yoga, Tai Chi, go for walks. That's, of course, difficult in the time of the lockdown, but get out in nature for some exercise can make a huge difference. So, for key foods, not just the green leafy vegetables and the legumes, the pulses, the beans, mushrooms, also a very important food for enhancing the immune system in very deep, complex ways. Berries are really your optimum fruit there. All fruits are good. Eat as much fruit as you want, but really tune into the berries every day. Blueberries, blackberries, strawberries, raspberries. You just can't beat them for the nutritional power. And here's the key question. Which vegetables are the best? This is Dr. Esselstyn's list, which I like to recite: bok choy, Swiss chard, collard greens, beet greens, mustard greens, turnip greens, napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, arugula, and asparagus. So, great list. I mean, variety is key. Eat as many different ones as you can, and eat them often. Once again, Dr. Esselstyn recommends 6 times a day. If you can get up to 3 or 4, you're way ahead of the pack, that's for sure. So it's a big challenge to suddenly eat in an extremely healthful way, but now's the time. Here's the key thing. If people make big changes to what they eat, big enough that they start to see really powerful, remarkable, miraculous changes in their health, they tend to stick with the diet. Whereas if they just do some small things here and there, they're trying to make baby steps, as is often recommended, they don't notice any change in their health. So as a result, they don't stick with it because they haven't seen any positive development. So, but it's not an easy thing to do. There's a lot of obstacles personally, socially, culturally. There's a lot of obstacles. I talked about the pleasure trap last time, but I don't think it got into my presentation on YouTube. So let me just go through it very quickly again. This is from psychologist Dr. Doug Lisle, who wrote a book called The Pleasure Trap. I highly recommend it. Basically, if we eat healthy food, we have a normal level of pleasure. But if we get attracted to the kind of foods that predominate in our society these days, the food full of fat, sugar, and salt, what people call ultra-processed foods, it really enhances our pleasure level. But if we continue to eat that same kind of food, all of those pleasure centers down-regulate. They down-regulate. So that means that we're eating food that is highly stimulating, but we no longer get highly stimulated from it. We just have a normal level of pleasure. But what's the implications of that? If we suddenly now try to eat really healthy food, and we're used to this ultra-processed food, what we experience is a subnormal level of pleasure. And that means that we don't like the food. It's not appealing to us. We just can't find it in ourselves to want to eat that kind of food anymore. which is, I think it explains so well the experience of children, adults of all ages, when you try to present healthy food to them. They just don't like it. And this explains exactly what happened. But here's the good news. If you stick with it, give yourself a few weeks, your brain centers, your tastes and perceptions of food, everything adjusts itself back to normal if you give yourself a chance. It can take 2, 3, 4 weeks, maybe as much as 6 weeks if you get rid of the salt, get rid of the fat, get rid of the sugar. So I recommend very strongly for people not to eat a complete abstention from all of these ultra-processed, overstimulating foods. It is just not possible for most people to begin to enjoy healthy, natural foods while they're still eating even a small amount of these ultra-processed foods. Another distraction, I think, for a lot of people is the fact that there's so many different dietary theories that are in popular books, in the popular media. Every day, certain foods are good for you, bad for you. And many people, all their friends are on keto diets and low carb diets. They're extremely popular these days. But if you delve deeply into the science, you see a clear pattern. If you look at the more people follow low carb diets, they can lose weight in some cases, but almost consistently they have an increased risk of dying. So what they talk about in the medical literature is all-cause mortality. So what you see is that people, the more they follow a low-carb diet, the more they have a risk of dying. You can see that in these graphs that this is not just one study, but all kinds of different studies have been done, and they see a clear pattern that the more we follow a low-carb diet, the more risk we have of dying. And we can see this here. I call this the low-carb death curve. Please share it with your friends. I'm sure that all of you have friends who've tried low-carb diets or are trying low-carb diets. We can see clearly, look, if we look at the percentage of energy from carbohydrates in the middle, as we eat less and less carbohydrate, what we see is people have higher and higher and higher risk of dying. So that should be enough to discourage a person from following that type of approach. It's very clear what we need to do, which is to eat more whole plant foods, green leafy vegetables, legumes. As I say, we can see in the research that the biggest predictor of mortality in older populations is how many legumes that they eat. Green leafy vegetables, fruits, whole grains, nuts and seeds. All of these whole plant foods have tremendous health benefits, to the point that if we eat a diet exclusively or almost exclusively based on these foods, we can actually reverse the disease, all these common diseases. Hypertension in a few weeks can disappear. A few months, type 2 diabetes can be radically improved. Cardiovascular diseases with a lot of lesions in the arteries can be reversed on a time scale of a year or two. The symptoms can improve dramatically in just a matter of weeks. So this is an example of a whole food plant-based recipe that I hope I'll encourage you to try it. Let me just say a few words about the origin of this recipe. I had a friend of mine from Sri Lanka. We had a long discussion about the kind of food she ate as a child growing up in Sri Lanka. They had mango trees out in their backyard, and so they had abundance of fruits and vegetables. They had a weed in Sri Lanka known as purslane. It's not the Sri Lankan name, but purslane is incredibly weedy type plant. Once it gets established, then you hardly ever have to replant it because will keep reseeding itself every year, and you'll have an ample harvest. It's very tasty, full of omega-3. It's really a superfood of green leafy vegetables. She was telling me how her mom would prepare purslane with red lentils, and red lentils are a wonderful legume to get started with because they cook so quickly. They're very digestible, very inexpensive, quick, digestible. Sometimes if you're new to beans, legumes, they can be a little bit gassy at first because their digestive systems, our guts are not used to handling all the fibrous plant material. But red lentils tend to be very digestible. People have an easy time with them. So she was telling me how the red lentils were cooked with the purslane in a curry type of seasoning. So I played around with it and came up with my own version of a recipe that I think would be something like the dish that her mother prepared when she was younger. Now, don't be put off by the purslane. Very possible you won't be able to find it in your grocery store, but you can replace it with any green leafy vegetable that you prefer. Beet greens, spinach, Swiss chard, kale, mustard greens, just about any of these green leafy vegetables. Chop them pretty finely and cook your red lentils. You have your onions and garlic, also extremely potent nutritional benefits from the onions and garlic. And then we have some spices to give it some flavor, which is the key thing. Instead of fat, salt, and sugar as the basis for food pleasure, instead we're using color, taste, textures, and different herbs and spices to give us that pleasure. This is kind of a standard curry blend. Turmeric, which gives it that yellow color, and there's been so much research on the benefits of turmeric these days. We have cumin, coriander seed, and also some cayenne. So be careful with that, play around with it. If you don't like things too hot, don't put in too much cayenne. If you really enjoy heat, make sure that you add more for your personal preference. The turmeric can make it a little bitter, so maybe you want to go easy with that at first. Try to find the right balance until you get the cumin and coriander, right amount of heat from the cayenne, just the right amount of turmeric that you still find it very palatable. And as I say, chop any kind of green leafy vegetable that you prefer, whatever you have in your house. If you're in the grocery store, try to find whatever looks freshest. I was in the grocery store yesterday looking for some beets, but the beet greens were just all wilted, so I didn't even buy them. So you want to take a look at the quality, see what greens look best and freshest, and bring them home and test out this dish. So please, once again, if you want more details on the nitric oxide hypothesis and the endothelial dysfunction and the role of the nutrition in the COVID, check out the part 1 of the series. Please, I appreciate if you subscribe to my YouTube channel and tune in to next week's webinar. I'll post it on YouTube again, but if you want to tune in live so you can ask some questions, please send me an email. I can put you on the list for next week's live session. And please, everybody, stay safe and make sure that you eat your greens.